The number of daily COVID-19 cases across the United States has doubled in the last 2 weeks, reaching a 6-month peak. Hospitals in at least 5 states say they're stretched to capacity due to the highly transmissible Delta variant. The strain is rapidly spreading, mostly among the unvaccinated. Oftentimes, there's nothing doctors can do.
It just makes you feel like you're just helpless, like you can't, whatever you do, you can't help your patient.
The University of Mississippi has even set up a field hospital in its parking garage. It's reminiscent of earlier in the pandemic, when field hospitals were set up in New York. How can the U.S. contain the current rate of infection? Welcome to your COVID-19 special here on DW. I'm Janelle Dumalaon. The U.S. Centers for Disease Control has presented evidence which they say shows vaccine efficacy waning over time. On Wednesday, President Biden announced a booster program, saying he expects the CDC to begin a third course of vaccinations from the 20th of September. The CDC is careful to point out that jabs are still highly effective in reducing the chance of hospitalization and death. Yet the country is still battling a flood of misinformation and its harmful consequences.
Arkansas in the American South, rural, conservative, and religious. Here the Republicans are strong and the vaccination rates are weak. Randy prepares for his daily battle at the University Hospital in the capital, Little Rock. His enemy's name is Delta. Randy is putting in an extra shift today because there's not enough staff to care for the current wave of critically ill patients. More and more pregnant women are coming in, as well as young people and children.
Everybody has regret. It's heartbreaking. Every patient here, unvaccinated, that's sick, regrets it. It is so hard to watch somebody in their last week of their life, last days of their life, know that it's at their decision. It's at their decision they made to be in this room, in this bed, and know that they're probably not going to make it.
Tate Ezai was dealt a heavy personal loss. We meet him at the hospital. His wife, Christine, is at home, traumatized. Until just recently, they were a happy family. 5 children, active, no fear of COVID, no vaccinations. Then came Delta. They both fought for their lives for weeks. Christine was 6 months pregnant.
I still thought she'd be okay, but like I said, as things got worse and worse, I started really worrying about the baby. And then at some point, the baby just didn't make it. She was too low on oxygen. And then I just worried about her after that.
It's a contentious issue across the country, one that is still being fired up by the political right, by the media, preachers, and politicians, while infection rates soar.
There will be no restrictions and no mandates in the state of Florida.
The Delta variant was nonsense then, it is nonsense now. You will not wear masks in this church. You will not wear masks in this church. I'm telling you right now, do not get vaccinated. Do not get vaccinated.
Many people feel unsettled. Corey Gordon does her bit to counter that in her small pharmacy in Little Rock. Anyone can come here and get vaccinated, like everywhere else in the U.S. A vaccination is as easy to get as a cough drop. More people show up every day, afraid of Delta. These children just want to go to school again and be carefree. This postman just wants to deliver packages. Tate's personal loss was painful, but he says it wasn't pointless if his story helps convince people to get vaccinated.
We're now joined by Peter Chin Hong. He is a professor of medicine and infectious disease specialist at the University of California, San Francisco School of Medicine. Welcome to the program. Now, COVID cases are on the rise and hospitals in the U.S. are filling up again, and they're mostly unvaccinated people. Could this cause a change in thinking?
It certainly has caused a change in thinking at the ground level with individuals who have been unvaccinated now, I think, feeling motivated to get vaccinated. I think overall, though, it's been a huge blow to the psyche of the American population, particularly those who have become vaccinated, because it just shows that we are not necessarily completely invincible by having a vaccine, and we're only as strong as our weakest link, meaning that not everyone has gotten vaccinations, and maybe if more people have had them, we won't be in this predicament that we're in right now.
Now, every state has had its progress derailed by Delta, but the effects have been especially severe in the South. Why is that?
Well, it all comes down to a very simple equation of protection. And if you're not protected, you get a lot of cases, you get hospitalizations, and you get deaths. And by protection, I mean simply vaccinations. Many of the southern states, Arkansas, Louisiana, Texas, Missouri, they haven't really embraced vaccinations. So that's one part of the equation, probably the most important issue. The other issue is, of course, political will to institute other population level mitigation factors like mask wearing. And many areas in the South are not only politically divided about mask wearing and some of these other factors that we can use to help prevent disease, but they're actually very violently opposed to it. In fact, in Florida, having legislation against having mask mandates is a step that's really extreme, in my opinion. So vaccines, lack of masking, a highly transmissible variant runs like wildfire in areas that are not highly vaccinated. So you get a situation of two Americas, basically. The America of the vaccinated, the America of the unvaccinated. And because this is regionally divided, you have this dyssynchrony between some states like those in the South and the rest of the country.
Are you optimistic at all that those two Americas that you speak of can be bridged?
I'm optimistic in the long term, but in the short term, I think it's going to be a very bumpy journey. And whether or not it takes another variant again to encourage more folks to get vaccinated, whether they're the result of mandates, which are, again, having a sea change of effect right now in the U.S. with federal employees associated with the military, federal employees associated with the veterans healthcare system, many states instituting mandates, school mandates, and most importantly, I think the requirements to go to bars, hospitals, and gyms and concerts in some cities like New York and San Francisco will drive those who are undecided to eventually get a vaccination. But at the end of the day, there's going to be this core of Americans who are really never going to get a vaccine no matter what.
Thank you very much, Peter Chin Hong. He's a professor of medicine and infectious disease specialist at the University of California, San Francisco School of Medicine. Thank you for your insights today.
Thank you, Janelle.
Time now for one of your questions. Over to our science correspondent, Derek Williams.
How many COVID-19 patients are vaccinated? What is the ratio compared to unvaccinated patients?
Everyone wants to somehow nail down this number, but the situation is just really fluid and the picture is really murky, which is no wonder because there are so many moving parts that can influence how many breakthrough cases occur. First and foremost, of course, is how much the virus is circulating within a population at any given moment, and which variants, but also which vaccines are being employed in different countries. The percentage of fully vaccinated people who end up as patients in hospitals after breakthrough infections in Israel, for instance, can't really be compared to the same group in, say, the UK, because the two countries have different rates of vaccination, different variants might be surging at different speeds, and Israel relied mostly on the Pfizer-BioNTech vaccine, while Britain bet more heavily on AstraZeneca. And those are far from the only factors that flow into the equation. What's clear is that the number of breakthrough infections appears to be rising in some places at rates that have experts alarmed. The issue is at the heart of new guidelines announced by healthcare authorities in the US on Wednesday. They're based on new data indicating protection could be declining over time.
Even though this new data affirms that vaccine protection remains high against the worst outcomes of COVID, we are concerned that this pattern of decline we are seeing will continue in the months ahead, which could lead to reduced protection against severe disease, hospitalization, and death.
In response, the US has now decided to follow in the tracks of other countries and begin offering people over 18 there another booster shot, although plenty of scientists still argue that that move is premature. So in summary, it was difficult enough a few months ago to calculate how many people were getting COVID-19 despite vaccination. Now, factoring in a possible drop in protection and the more transmissible Delta variant, that's making the equation even more of a guessing game.
Thanks for watching. Stay safe and see you again soon.